Bismillahirrahmanirrahim. Bone and its relation to extracellular calcium and phosphate is discussed in this video. The matrix is the extracellular component of the bone, and it is tough organic matrix that is greatly strengthened by the deposits of calcium salts. It is mainly divided into two parts: the osteoid, that comprises about 30 to 35% of the bone matrix, and then there is minerals and salts that comprise about 65 to 70% of the matrix. In new bone there is high percentage of the matrix compared to the salt. So the main component of the osteoid is type 1 collagen that comprise about 90 to 95% of the osteoid, and it provides tensile strength and aligned along lines of the stress, that are tensional forces, lines of the tensional forces or lines of the stress. Then 5 to 10% of the osteoid is ground substance. This is gelatinous fluid composed of extracellular fluid and proteoglycans like chondroitin sulfate, hyaluronic acid, and their function include supporting mineral deposition and matrix hydration and resilience. The main crystalline salt of the bone is hydroxyapatite, calcium 10, phosphate 6, and hydroxyl 2 is the formula for this hydroxyapatite. Then its shape is a long flat plate about 400 is to 100 is to 10 to 30 angstrom. This hydroxyapatite is responsible for hardness of the bone and is also serves as a reserve for 99% of the calcium and 85% of the phosphorus. The calcium to phosphorus ratio, it depends on the nutrition, and a ratio is between 1.3 to 2. There are additional ions present such as magnesium, sodium, potassium, and carbonate, and these ions do not form distinct crystals but are conjugated with hydroxyapatite. Then there are foreign ion incorporation into the bone. These elements can be absorbed by the bone such as lead, uranium, strontium, plutonium, and gold. Some of these are radioactive, and they may lead to development of osteogenic sarcoma due to chronic irradiation. Bone is a composite material made up of collagen fiber, that is organic, and hydroxyapatite crystals, that is inorganic material. These two components give both the flexibility and hardness to the bone, enabling it to resist various mechanical forces. The tensile strength uh, from the collagen fiber is given, and this tensile strength is equal to the resistance to pulling and stretching. This comes from collagen fiber arranged in a repeated uh, period structure every 640 angstrom. Hydroxyapatite crystal bind to these repeating segments tightly. This prevents slippage or and shearing or torn apart of, and giving bone high tensile strength. Then there is compressional strength that is given from the calcium salts. And compressional strength is resistance to crushing forces. It is mainly provided by hydroxyapatite, and these mineral salts are hard and dense, ideal for bearing weight. So the collagen fiber overlap hydroxyapatite crystals, interlock like brick in a wall. This interlock design prevents cracks and ensure shear resistance. So the tight binding and overlapping of the organic and inorganic elements create a reinforced structure that can bend slightly without breaking due to collagen and bear heavy loads without collapsing due to minerals. Bone is stronger than concrete by weight and lightweight also, perfect for the human body needs. This picture is showing the hierarchical structure of bone ranging from macro scale skeleton to nano scale collagen green and this hydroxyapatite that is red in color. The collagen model with 0% mineralization over here, this is 0% mineralization, and here 20% mineralization and 40% mineral content are shown. The hydroxyapatite crystals are arranged such that the C-axis of the crystal aligns with the fibrillar axis. Calcium atoms that are plotted in green and hydroxy groups they are plotted in red and white, and the tetrahedron structures they visualize the phosphate groups. So combined these two organic and inorganic material that has got a characteristic plate-like appearance, it gives both the tensile strength as well as compressional strength. The tensile strength is given by the collagen fiber while compressional strength is by calcium salts. The calcium and phosphate ions and are both present in high concentration in the extracellular fluid. Together, these levels are chemically sufficient to form hydroxyapatite crystals. But despite this, the crystal don't form everywhere in the body. Why? Because there are inhibitors that prevent unwanted crystallization. There are biological inhibitors, for example, pyrophosphate, that are present in the plasma, interstitial fluid, and most soft tissue, and these molecules prevent spontaneous precipitation of calcium phosphate salt outside the bone. So hydroxyapatite only precipitate in bone where the environment is controlled and is favorable. The designed site for the precipitation is the bone. The body actively promotes precipitation of hydroxyapatite in the bone only because in extracellular fluid there are inhibitors of precipitation present that are pyrophosphates. Thank you for watching this video. If you have any query, please write in the comment box.